Welcome to the Transformative Neurotherapy Podcast with your host, Dr. Heather Putney, founder and executive director of Transformative Neurotherapy. This is the place where healing happens faster. Because let's face it, your brain doesn't come with an owner's manual until now. Here, we take a holistic approach to brain health, bringing together science, mind-body harmony, and the tools you need to optimize your well-being. Whether you're a high performer, executive, athlete, longevity hacker, or just someone tired of your brain working against you, Dr. Putney is here to help you unlock your full potential. From brain fog to chronic stress, we're covering it all so you can finally experience brain health, mind harmony, and total well-being. Ready to get unstuck? Let's get started.
When healing can't wait, intensive neurotherapy offers a focused, accelerated path to transformation. Welcome, everyone. I'm Julie Schwenzer, co-host and producer in the studio with Dr. Heather Putney, founder and executive director of Transformative Neurotherapy. Dr. Heather, it's great to be back with you. Let's dive in. What is the healing power of intensive neurotherapy?
Well, I guess with intensive neurotherapy, the name kind of says it all. It's pretty intense, but I would actually substitute that out and say, efficient. One of the things about me and one of the reasons why I got interested in neurotherapy is how fast it moves the needle. So, it's a very efficient treatment generally, but intensives are efficiency on crack. So, but really it's like, it depends on how much you're suffering, right? How fast do you want to feel better? Neurotherapy is about, it's about your brain learns by experiencing. So we're kind of, we've talked about how we do all the different, mapping and figuring out where the maybe where the injuries are or where the imbalances are. And we try to feed the brain, what it needs that's to help it balance itself, or to heal itself. So, the brain basically learns by experiencing. And so our traditional neurotherapy, especially getting started, we want to start at like a minimum of 3 times a week for at least 3 weeks, because the brain needs to, have that input, and the treatment effects tend to last 24 to 48 hours, and then by that time we're giving it another little boost. And so it kind of, so the brain gets that and experiences it again. And then you're doing those boosts enough till the brain starts to kind of learn how to do it and starts to feel normal because the brain's kind of being held in that place. And then it learns how to do it on its own. And then that's when, then we start to kind of titrate out and be done once, once we get there. But the difference between that approach versus an intensive approach is we can actually do up to 2 treatments a day, for 5 days, for a week, or 2 or 3 weeks, depending on the client. And so what happens is, if we're giving this input so many times, we can move the needle a lot faster. There's not that like regression between sessions because it's just getting that boost, 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 boost. And so it really kind of pushes it faster. It's just kind of like anytime you're trying to learn a hard subject at school, the frequency in which you study it, the more it gets ingrained into your brain. And this is the same thing. And then what happens is because you're not having so much regression between session, like we have to like, oh, we've forgotten this and we have to relearn. It actually reduces the total number of treatments that we need altogether. And the brain can like shift that much faster in a week. It's really incredible to see how much you can gain in a week, and sometimes, like I said, depending on the clients and depending on the severity of what we're dealing with, sometimes they live far away. They don't have a provider that is in their backyard where they can come in, 3 times a week, or they just want to take a week off of work instead of trying to like schedule into their day. And they're just going to kind of like focus on their healing, kind of take like that little healing sabbatical, and they just want to bust it out as fast as they can. And then maybe they'll do some little tune-ups afterwards because it may not, that week or 2 weeks might not be enough to kind of be at the end all be all, but they will have made so much traction. They'll feel so much better. And then the little boost, the fine tuning you have from there is just so much better. So, we see this with clients that are really suffering or clients that maybe struggle to get away from their days where it's just easier for them to maybe come in out of town and just really focus on their healing kind of in that centered place and really move the needle.
And like in addition to schedules, commuting, And what you just mentioned, are there any types of patients that benefit the most from the accelerated approach based on their condition or their injury or their symptoms?
No, they're all going to benefit from it.
That's
It's
amazing, though,
how much
that they have the
it's
option.
yeah, it's really great. It's just how fast they wanna feel the results. But some clients and certain things are going to need more total treatments altogether, and so by adding an intensive to get it started, they're going to massively reduce the total, or they're going to reduce the total number of treatments at all. So if we're dealing with developmental delays, or more severe slowing, that's a little bit more rehabilitative, and so those ones are gonna take longer, so the more intensive approach can move it along a little bit faster. But, we work with trauma clients, clients dealing with addictions, severe depression, whatever it is, and they come in. And so they can all benefit greatly from the experience.
And again, I know, each patient's so different, but could you walk us through one example of what a traditional or a typical intensive session looks like, or at least the first few sessions in the beginning? Like, what happens when you come in the door and they meet Dr. Heather?
Yeah, I mean, some of this isn't so different than any way we're gonna do, neurotherapy in general. We'll try to have them come in for a brain scan, and we can work on that neurofunctional report, so we really have a good sense of what they're dealing with, so we have that plan before they even walk in the door, and when they walk in the door, we're gonna be doing, generally 2 treatments a day, as long as the client, can handle it. So sometimes they'll start out that frequently, and then maybe at the end of a week or a week and a half, they start to feel maybe a little, a little too tired, and we'll slow it down to 1 treatment a day or something like that. We really kind of try to be in tune with the client. It is exhausting. They'll probably feel tired at the end of the day. We're asking their brain to do a lot and to shift a lot. And so they can have, while the brain is rewiring and mixing up, like some, they may have feelings they haven't felt. They may have trauma release that they didn't realize it was there. And so they may feel a little disoriented before they feel better, but that's normal, right? It's almost like when you're going into the room and you're going to reorganize it, you dump everything out on the floor and then you reorganize it so it looks worse sometimes before it looks better. That's not uncommon here. And so we just let everybody know from the get-go, like, we're going to do this fast. It's going to be disruptive. Sometimes disruptive is unsettling. That doesn't mean where we're going to get isn't so much better than where we started. And like I said, we people do notice, oh, I'm sleeping better. I might feel, or they might have a little bit of highs and lows while they're, in the beginning, but at the end of the day, they feel better. The other thing that we do to make sure that we're on target is we do measure their symptoms every day, of the different types of things that we're trying to improve. So maybe they're coming in for brain fog, maybe they're coming in for sleep issues, maybe they're coming in for depression, or ADHD, inability to focus or get tasks done. So we'll have these different things that we're tracking, how are they doing in certain ways. So we're measuring that. And then at the end of the first week, we'll do a rescan and we'll compare how much the brain shifted from, the before the first treatment to the end of the first week. And it's amazing to see how much the brain changes. And then that allows us to kind of, um shift gears, tailor, and tweak the treatments to what the brain needs next. Because maybe what we were doing, it got it, it picked it up, and it doesn't need us to keep, beating that dead horse. Now we need to move to the next area that needs a little TLC. So we do frequent when we're doing that many treatments, we also rescan, compare, and adjust a lot faster. Then we get to show those results and those changes, to the clients, and they get really excited when they see, like, oh my gosh, my response time is like 100 milliseconds faster than it used to be. And oh, look at those things. It looks so much more organized than it looked. In addition to the symptoms they're feeling, they get to kind of really see that feedback, which is great. Another thing, because you asked about what it looks like, is, I mean, they'll come in, they'll do a treatment session, and then we ask them to, take a break. They're going to eat, they're going to drink, they're going to refuel their body, rehydrate their body, so that they can do the next treatment. We also work very closely with our sister company, Untethered Therapy, especially if people are coming in from out of town. And we may pair them up with a therapist while they're there, because they might be working on trauma, they might be working on certain things, and so this really makes their brain much more flexible, or it might actually bring up a lot of things that they want to process. So we may, like I said, pair them up with the appropriate therapist. So they might do a treatment or two and then meet with a therapist afterwards to kind of process some of the stuff and kind of keep that process going. So, depending on the needs of the client, we'll integrate other supports in addition to the neurotherapy to help the client get to where they want to go.
Dr. Heather, could you please share some real life examples of success stories for us so we can learn more about how it really helped somebody?
We've had several great experiences with people coming in for intensives, but there's a story that stands out to me. Um, and this person lost their spouse unexpectedly and ended up becoming a single mother overnight. And it was not only traumatic for her, but for her 2 kids. And she just was, she was in a very high kind of executive kind of position with work. She had a lot of pressure there, but then all of a sudden they're dealing with all this like grief, trauma, and loss at home, and a lack of a support, another support person, the parent, and so forth. And I mean, she and the oldest daughter in particular were both just kind of in this really severe grieving state, really shocked state, really kind of sympathetically over aroused, difficulty sleeping, very just, um, just not functioning. And her job was pressuring her to come back and function. I mean, they really weren't very supportive for her healing. And so she decided that she needed to do something more intense. So she came in with the kids for a week, and herself and the oldest child did intensive neurotherapy, and they only had a week because they had to go back to work. And I'm not going to say that they were like healed and great, because severe trauma like that doesn't move that fast. But their ability to sleep, their ability to feel more calm, the ability to be able to think more clearly, to be able to function better, to be able to kind of process what had just happened increased exponentially for them. And then, a few months later, they came back in and did another week, and just like kind of fine tuned and, kind of built upon some of the work that they had done. No, actually, it was not a few weeks later. It was several months later that they were able to come back, and I misspoke. But that's what worked for their schedule, both sessions really helped them get a lot further. And I mean, that's not a typical, that's a intense trauma that you weren't expecting, but the results were really good, and the client was just so grateful that we could move the needle that much, just her ability to kind of move forward and move on. We did mix that with talk therapy in addition to just the straight up neurotherapy. We were working on calming down the nervous system, but also processing the trauma at the same time. And she saw extraordinarily great results. So just
Well,
one example.
that serious trauma. That's amazing that you were able to help so much. Dr. Heather, again, it's been a pleasure. Thank you so much for giving listeners a powerful look at what's possible when healing is prioritized. And we'll see you next time on the Transformative Neurotherapy Podcast.
You've been listening to the Transformative Neurotherapy Podcast with Dr. Heather Putney. Remember, your brain isn't supposed to hold you back. It's supposed to power you forward. So stop letting it crash your party and start letting it do its job. If you're ready to optimize brain health, sharpen your focus, and age like a fine wine, schedule your free consultation today at transformativeneurotherapy.org or call us at 412-204-7397. Because here, healing happens faster. See you next time.